At age 66, Ron Swanda is a survivor. In 1989, the Nebraska native tested positive for HIV.
I knew that in the past I had had unsafe sex before I even knew what HIV was. So when I tested positive, I said to myself, I'm probably going to be positive. And when he said the results, said, well, you are. And I can't tell you how shocking it was to me, even though I expected it.
Back then, the diagnosis felt like a death sentence. But 23 years later, Ron is still fighting the virus, and he's not alone. By 2015, half of Americans with HIV will be over 50. AIDS policy expert Ronald Johnson was also diagnosed with HIV in 1989. He says HIV testing, critical to preventing the spread of infection, is overlooked in the over 50 community.
The myth that once you're 50, you're no longer sexually active is a myth. Young people need to be tested, but people over 50, people over 60 also need to be tested.
Conditions typical of old age can appear earlier in people with HIV. Ron's sight is failing, and his medication is weakening his bones.
After my cataract surgery, I fell because my sight was infected, and I made a small fracture on my hip.
Despite the challenges, Ron is tirelessly active in the AIDS community, pushed by the memory of friends he's lost.